Welcome to the Recovery Roundtable Podcast, where the journey to sobriety opens up through powerful discussions and shared experiences. Join your host, Mark, who will bring you stories of triumph and resilience from the heart of Pacific Shores recovery. Every episode offers insights and support, guiding you through the challenges of addiction recovery. Thank you for joining our community. If you're ready to start or continue your recovery journey, we're here to inspire and support you. Let's explore recovery together.
Yes, so some of the biggest questions are from people that have never been to detox, don't understand detox. Okay. And so I just basically want to give them access to the doctor to say, hey, I got some questions, and everything I look up online is so sterile or medically based. Like I want to know from a human that's done this. I don't know how many thousands of times we've been working together for a while, but one of the basic things is what happens in detox. Like, so when a person comes in, basically what does that look like and what happens?
As far as like, just for talking right now,
yeah.
You want to know like when they come in, like just from my standpoint, like first we assess you, we see like what you're withdrawing from. You can withdraw from either alcohol, benzodiazepines, opiates. That consists of a 6 to 7 day detox. Sometimes we have to extend that if people continue to have symptoms. We base it off a CWalk house scale. We use evidence-based scales to determine.
And so that is all the sterile doctor talk.
Okay.
Like the way you and I talk, like when we're talking, like, hey man, here's like, I love that. That's one of the reasons why I love working with you.
Give me an example of like if I said to you like, hey, what does a detox consist of? What do you want to hear?
Well, basically just kind of layman's terms of, let's see what happens in detox. You know, when a person comes in, they're not really sure what to expect. A lot of times we get people in, they're experiencing all type of things, from different emotions, fear, whatever it is. And so the first thing is making sure that they're safe, but also addressing what's behind everything.
Okay.
Or something along those lines.
I might get all doctory.
Yeah. Well, if you get all doctored, smack. No, I'm kidding. If you get all doctored, that is fine. What I've found really relates the most is kind of what we're doing right now, is just talking back and forth. So as far as in detox, and I know you know all the medical terms and different things, but let's say there's a client who's really afraid and not sure it's their first time, and they're like, I don't know if I should detox. Why should I even detox? I've been drinking my whole life. So
we
what are some
about,
things?
like if you like, we could talk about like, well, when you come in for a detox, it's a medical detox. We're going to use medication. We're trying to prevent seizure activity. Sometimes people stay at home and they try to do this because they did it before. Biologically, as people get older, it becomes more difficult. You can have more medical symptoms, more medical issues at home, and you don't want to do that at home. Under a roof like this, it's safe. You have medical staff. You know, we can monitor your vital signs. We can do medication-assisted treatment.
So a lot of people, if they try to detox at home, there's actually a lot of dangers.
Well, for like if you take benzodiazepines and alcohol into account, you can,
which we see quite often.
You can withdraw. You can have seizure activity.
Okay.
You get to the point where you lose consciousness, and anything can happen at that point.
So if a person's alone at home and they're trying to detox on their own, it could get serious. And if they're with a loved one, the loved one may not know what to do.
Loved one might not know what to do. And if somebody does come here and we're doing a medical detox with them, we can always communicate with that loved one. And if they have any questions, they can always contact us.
Okay. So let's say, now they're kind of getting a little bit more educated. They're understanding, I didn't even know what could potentially happen while I'm trying to detox myself. Not just the physical pain, but you're saying it could be endangering their life.
Yeah, and people can be intimidated, especially people that have tried to detox at home before. And maybe they did it successfully because they were younger and they weren't under that much of an influence of something. And it's understandable to be nervous to come into a situation like this. You don't know what to expect. Should I talk about medical, like going to the hospital versus, should I say something like that?
Yeah. No, this is actually, the way we're talking right now, this is fantastic.
Do you want to talk about like the medical, if there's medical issues, we should refer you to the hospital. Like if somebody comes in, I could talk about that. Maybe somebody can see that and be like, oh, wow, if I have a medical issue, maybe it's better to detox.
Yeah, so, one aspect that you hit on, that's the beauty. There's not staying away from anything. One thing that you said, though, is if a person has been using for a while, it's a progressive disease, if they tried it on their own before and were successful, but as it's progressed, they may have the same thought process back then, like, hey, I did it before, but because it's been progressing, there's underlying health issues, all sorts of stuff that could actually put them in a real precarious space.
Well, like if you're going to pass away easily, or a lot of people. I mean, let's not get into it now, but a lot of people, like especially try to detox from opiates, they'll go home and take a shitload of kratom. Right.
So
they'll pass out, and then they'll have nerve damage from like being on a limb for 8 hours and being completely, So we would probably just tell them like, there's medical risks of staying at home, especially with age or how much you're using or what you're using. The body always changes, drug stays the same.
Well, and that's really good to know, because a lot of times people will think, oh, I'll detox. People say detox using other medication. I'll use herbal medication, which you've heard the argument with kratom or different things before. But if they're doing that at home in a non-medical type of setting, they can actually harm themselves more.
Oh, sure.
Okay. So then why would you recommend a person actually comes into a facility as opposed to just trying to
at a facility,
quit cold turkey?
At a facility, when you come in, you have 24-hour care. You have 24-hour nursing staff that's here on site, checking your vital signs, administering medication, using the tools we have to see, to kind of measure your symptoms and see how we should administer medication to you. That takes place regardless of how you feel, so we have that working around you. That's the benefit of coming into a place as opposed to staying home.
Okay, so first thing is because there's continual checking, there's actually timed rounds. If something bad happens, there's someone right there to deal with it, as opposed to at home, it could be all bets are off.
At all times.
Okay.
And then, again, if family has any questions or anything like that, we're more than happy to answer those questions for them.
So what can someone expect when they come into detox? And I know it's kind of a very broad general question, and it depends, but just kind of overall, what can they expect to go through?
Depending upon like what you're withdrawing from, whether it be alcohol or opiates, you don't want to like name every symptom that they're going to go through.
Right.
But typically somebody starts withdrawing and feeling withdrawal symptoms in the first 24 hours.
Okay. And so what happens within that first 24 hours?
What we will do is we'll test you to see what's in your body when you come in, see what you've had, so we know what we're working with. We get an idea of how much you're using, how long you've been using it, and if it meets medical necessity and criteria, we'll go ahead and implement a medication to bring you down. That's usually a narcotic like a benzodiazepine to bring you off alcohol or benzos, and it's usually Subutex, Suboxone to bring you off opiates.
Okay, so one of the things that we have seen quite often is when a person comes in, either out of fear or something, they will either intentionally or unintentionally withhold some of the information. So why is it important to know, hey, you're not here, you're not going to get in trouble. It's like we need to know everything so we can best serve you. Why is it important for a person to know, to basically just say, hey, here's exactly what's been going on?
Because if you give us an accurate understanding, sometimes people don't even need medication or narcotic to detox. They're just under the impression. If you give the appropriate information, the amount you're using every single day, it might not even be necessary to give you Valium or to give you Subutex. You might have only been using a few days in which we can use something else. We wouldn't want to give you something you don't need.
Okay.
On the other side of that, it'll let us know if you do need medication to withdraw. And everybody's different. And we use the tools to take that, assess those symptoms objectively. So, we have what you're telling us and what we see.
Okay, so number one reason why and what to expect is for safety, to make sure that you are here and present and safe because you have people around you. Second thing is what about either comfort or discomfort? Does that play a role?
It plays a role, and a lot of patients, they don't know all the symptoms. They don't know what to expect when they come in. Staff's very familiar with that and can get a jump on that before it gets too bad. For example, like alcohol withdrawal. Your blood pressure is going to go up. Mm-hmm. People don't have blood pressure cuffs and stethoscopes at home to check that kind of thing. People can have secondary issues because their blood pressure is so high. We can control that with medication. We monitor that as often as we need to.
Okay, so it sounds like what to expect is by being completely open with the information. I like letting people know, look, we're on your side. You're not going to get in trouble. By sharing everything, they're able to find out, okay, here's the different medications we can go ahead and help you with. Then you've got 24/7 care to make sure that you are safe. We want to make you as comfortable as possible through this. And then when can a person start to feel a little bit better or kind of get on the tail end?
Usually, everybody's different.
Yeah.
But with alcohol and benzos, it's usually by day 6 or 7. And sometimes we have to extend that taper.
Okay.
With opiates, most of your symptoms are resolved by day 7. You're still going to have trailing symptoms from anything you're using for a while, but from a medical standpoint, you're not going to suffer any complications as far as seizure or that kind of thing.
Okay, because I know a lot of times there's a fear of, oh my gosh, how is this going to last forever?
Anxiety may persist. Those kinds, if you have psychiatric symptoms already in place, But some people still tend to suffer irritability, agitation, anxiety, those kinds of things. That can go on for weeks.
And that's something that you partner up with the clinical side of the therapist and the case manager to help give some different tools as well.
Sure. Some people have psychiatric symptoms going on at the same time with their opiate or alcohol or benzodiazepine withdrawal. So we can manage that as well as after your detox. Kind of make things easier.
So what are the top, let's just say like 5 things on average that you see people actually coming into detox from, where you would strongly suggest, hey, make sure you're at a place such as this to go through this as opposed to trying at home?
What do you mean as far as symptoms?
No, just what do you see the most people detox from, such as alcohol, sleeping pills, heroin?
Alcohol and opiates.
Okay, alcohol and opiates are the big ones.
Usually alcohol, because people just tend to stay home and try to manage it. They try to taper themselves down. Usually alcohol is difficult because sometimes they're traveling from some distance and alcohol can really put you down.
Okay, and then that's the one that you said is really dangerous to do
really
out of the medical setting. Okay,
that is probably the most dangerous one. So you never want to do that at home.
Okay. And then how long, and again, I know I'm asking super general questions and it's specific on the person, the drugs, different things, but how long does the detox typically take for an individual? Just kind of ballpark?
About 7 days.
Okay. So around a week?
About 1 week, yeah.
Now, after that week, what happens to that individual after detox?
They usually, if they have psychiatric symptoms, we set them down, we can address that, we do psychiatric evaluation. We also offer medication-assisted treatments such as maintenance on Suboxone.
Okay.
We also offer naltrexone and antabuse for alcohol if you want something long-term.
Okay.
We can test your labs to make sure it's okay to do that.
And have you found good results with that?
Yes.
Now, I know there's a big misconception.
We got to kind of be careful about what we're saying about stats if you're throwing it on YouTube, because I can't say then I have to get real stats and evidence to actually say that, so I can
Okay, then yeah, I just want to be very transparent and open. So if there's a stat thing, you can go ahead and stay away from that. But so some of the questions that I'm trying to think of is, because I know there's some common myths or misconceptions out there of maintenance assisted maintenance assisted programming or
MAP?
Yes.
Medication
assisted treatment. Thank you. I know there's some misnomers. Like I know some people will say, hey, if you're taking any form of medication, you're not sober. What would you say if someone was saying that?
I would say in the years that I've been practicing, I've had a lot of individuals come up to me and say, I feel guilty because it's one drug for another. Okay. Somebody tells me it's one drug for another as if I have a crutch. Mm-hmm. A lot of people, in this business, they don't have much of an identity. They're just trying to survive. And they listen to other people and their input. But here's what I see. The people that stay on maintenance, they tend not to go back to treatment. They get full-time jobs. They go back to school. I have a number of patients, my outpatients, who get married, have children, go on vacations. They don't talk about treatment centers and what level of care they're at anymore. Mm-hmm. They're the people that decided this is not one drug for another. Mm-hmm. We have this technology, we have this new medication, it works. It takes the craving away. It's something you can take once a day, twice a day.
So it actually helps with cravings.
Well, it takes them completely away because you're taking an opiate every day.
Okay. So if there's a misconception of switching one thing out for another, and I've heard this a lot of the time too, of, well, I don't want to be dependent on something. But for some reason, because we've seen diabetics before, I haven't heard many people argue you shouldn't take insulin.
Right.
Why do you think there's a difference of where it's like my body needs this in order to regulate correctly, and it's accepted by just about everybody, but for some reason this type of medication is controversial?
Well, to find a correlation, and I'm not sure, but I know in this population, especially people in their 20s. Okay. They're told that they're not truly sober.
Oh, okay.
And I like to tell them, whoever's in front of you, most often they're not going to be in front of you in 5 years from now, and you're somebody else if you make it that long. And you're able to do this. And I tell people, when you start maintenance, you're doing this for your life a few years from now. Right now, you're working on your sobriety. Nobody wants to have to take medicine every day, but at least you won't be going to jail. The police won't be after you. You won't be chasing dealers. You won't be out of money. Chances are you won't be homeless.
Okay.
Chances are you can achieve goals and move forward in your life. When you get to a place where things are different, you're out of treatment for a while, you're living your life, you're seeing a doctor, you start to come down off it there. And how long you want to do this, it's usually up to the person.
Okay.
How long they want to be on this and how they feel about it and who they're around and if they're supported with it.
So it sounds like if a person's struggling, they come into detox, and then there's a whole different world before them if they go ahead and actually engage and learn the tools, learn all that we go over in treatment. And you've seen case after case after case.
That's something that's year after year, just seeing people, if they stay on their maintenance and they adhere to a schedule and see their doctor regularly. Most of the time I see people stay sober off opiates.
That's awesome.
They maintain it.
So what are some of the biggest struggles that you see people maybe, I guess just struggle with throughout either the detox or even after the detox? What are some of the biggest things you see pop up? Some of the barriers?
Biggest thing that I see, and I try to tell patients, is a lot of patients come in and they'll have the personality where they don't want to be a problem. They don't want to communicate how they feel. They'll kind of isolate to the room and let the staff just come in. And I always encourage patients, if that's in your personality and you don't like disappointing people or making people work, or you feel guilty because you're asking for something, that they need to get rid of that. Because this is a relationship that we're forming. You need to be able to communicate every little problem you have. You've got to bring that forward to the staff, and I'm available 24/7 when you're in detox. So for example, one of the biggest problems I see is, of course, you have your detox symptoms. But if we don't have communication, we're going to have a poor outcome. So I always tell patients, no matter what you're going through, especially in the first few days, and I talk to the staff as well, make sure you come forward with everything, because you're on a scheduled regimen, and that might not meet your needs. You might need something 3 hours later and not have to wait 6. Here, what I like to do is, you talk to the staff, they call me, I get an understanding of how you're doing, and I give you something at that time, because I don't want you going up and down, And then we assess your level of detox and withdrawal symptoms, and give you the appropriate amount of whatever you're getting, coming off of, to keep you calm, to keep you feeling okay. Biggest problem is patients have difficulty communicating.
Okay, so it sounds like it's actually incredibly important to continue to share vocally of what you're experiencing, what you're going through, because each person's a little bit different.
Absolutely, and it's difficult. You already don't feel well.
Yeah.
And emotionally, a lot of people have problems, especially men. They don't want to get up and go talk to somebody. They feel like people are disappointed in there being a problem. But really, that needs to go away, and I always try to coach them. I want to hear from you.
So knowing that, look, there's a whole team here for you to continue to check in with, to make sure that we're getting those readings. The analogy that pops in my mind is like scuba diving. I used to love scuba diving. It's like, you look at your gauge, and it's important. It's not a thing like, oh, I don't want to ask too much for my oxygen. It's like, no, let me look to find out where it is so we can stay in the safe levels. So it sounds like as long as the person continues to share that information with that gauge, hey, here's what I'm feeling, here's what's going on, here's what it's like, we can go ahead and change as needed for what it is.
Yeah, and I tell them that's hard work, because you might not be used to having to get up while you're not feeling well and communicate this and keep stating that. That's hard work, and so we try to make that easier.
Awesome. You mind if I ask some personal questions just so people can know you a little bit better?
Yeah, please, go ahead.
So what got you in this field of psychiatry and addiction?
I spent 15 years on an inpatient psychiatric unit.
Okay.
And then as I branched out and later on I got licensed as a provider, I opened up a clinic. I was exposed to individuals coming in with addiction issues, and I just kind of gravitated towards that. I found it was more interesting. I found I could actually help people as I leaned into it more. I really enjoyed it. I like talking to people with these problems, like helping them. So 99% of what I do is addiction medicine and psychiatry.
Okay, and you've been doing this the majority of your life, it sounds like.
Since 2000.
That's huge.
Yeah.
So multiple decades experience.
Yeah, I've been doing this for a while. Mostly psychiatric patients dealing with psychiatric symptoms, and so probably about 7, 8 years of addiction.
Okay. So what are some of your favorite aspects of working in the addiction field?
I like to, I'll get some patients in and they just don't realize to the extent that they're self-medicating psychiatric symptoms that they never addressed. Rather it be from childhood or just something genetic or in general. A lot of people self-medicate, and you talk to them and they didn't even have access to a psychiatrist or psychiatry, or they didn't believe in it or some issue. And a lot of people come here and after their detox, in discussion, they have therapists here and I speak to them. A lot of people find out that they've been living wrong for a long time. They find out that maybe they've been in a toxic relationship for a long time. Maybe they've had depression and they just didn't really realize it. Maybe they're just intimidated to make an appointment with a psychiatrist, go and talk to them. So here you kind of just roll into that. And a lot of people, we can kind of discover that for you, help you with it, describe it to you. If that sounds familiar to you and you want to take that step, we can offer that. A lot of people are appreciative of that because they go home and they don't have access.
Yeah. So it sounds like a lot of times people don't know why they're doing something, and just by coming in and getting educated, there are things that are either undiagnosed, misdiagnosed, and they're not even aware of why they're doing it, just to try to feel or think different.
Sure. I've had people come in with alcohol, and it turns out when you really peel the layers away, there's a lot of abuse going on at home, whether it be emotional or physical or something like that. And a lot of people will be under the context that it's their fault, and they've never been exposed to really what's going on. And so we can uncover a lot of that. A lot of people, their eyes open. They realize that they're more like the victim. They're not to blame. They're just trying to feel better. And then they get judged. And so we try to change that context, because really, they're good people just trying to feel normal. So they end up using these things, they get stuck on them. We take that off, we try to help them, and
Another question that comes to my mind is, we've seen a lot of people come through this program and do amazing things, but we have seen some people come and kind of struggle. What do you think are some of the major factors of the difference of someone who goes on to be successful and live the life that they've been desiring versus someone that just continues to struggle?
Wait, say that again?
So a lot of people that come through here, we see them completely change their life. They go home and they live a complete different life, unrecognizable. They're living the life that they had imagined. We still see some people that will come through the program but struggle when they go home and just go right back to the same patterns. What do you think the difference is between the two?
Some people will address the issues as to why they self-medicate.
Okay.
Some people will do everything they can to, they'll take Vivitrol, they'll take maintenance Suboxone. Some people want nothing to do with it. And if a lot of people don't realize patterns of thinking that they have, behaviors that they have, and they don't work on those and they're not able to see it, chances are they just repeat the same thing when they go home. When stressors occur, or when they go in the same house, the same things happen. A lot of people think that you just come in with dropping alcohol and you go home, do what you're supposed to do, but usually you're self-medicating for a reason. There's something going on in the environment that either you see or you're turning a blind eye to. Things like that. I see people who don't fully invest in it.
Okay.
When they return home, oftentimes I see them come back.
Why do you think a person would not fully invest, or maybe kind of hold back only to repeat, as opposed to, even though it is scary as hell, saying, I'm all in, that this is my chance to change everything?
I think about that all the time. I don't know.
Yeah.
I just know myself. I know what I'm capable of, and I try to see that in others. But everybody has their reasons. Sometimes they don't tell you the truth. I've had many conversations with people that have 1 foot out the door, and I don't really know the answer to that. They have their own story. They have their own motivation as to why they want to leave or why they want to repeat the same patterns.
Yeah. So, and this is a part that I know a lot of people struggle with, I have struggled with this a lot in my life, but is this understanding of surrender and submission and just trusting the process to fully go in. You hit 2 key points of changing thought patterns and behavior patterns. Can you dig a little deeper on that?
I don't know. That's what I kind of came up with. The real answer is some people just want to use.
Yeah.
They just want to use. They're just not done.
Mm-hmm.
No matter what you say to them, they're just not done.
Well, that's where we see a lot of times, and a lot of people think you have to hit rock bottom in order to change, yet we've seen a lot of people actually come in and go, I don't want to have rock bottom in my story. I want to say, hey, this level of life right now sucks, and they change everything. And a lot of people say, I didn't have to hit rock bottom before I finally surrendered and said, I'm going to learn how to change my thoughts, I'm going to learn how to change my behaviors, and fully invest in like a 90-day program.
Yeah. I mean, I try to think about it when I was like 25 years old. Would I want to take a medication every day? I've never been in that circumstance, but if you can keep it in the context of, like you were saying, insulin for a diabetic, they have to take medicine 4 times a day. Mm-hmm. But oftentimes, like I said, when you have somebody young who doesn't have much of an identity, and they project this image of how they want to be seen, oftentimes that image has nothing to do with taking a medication every day. Mm-hmm. And so it's just not what they want to do for those reasons.
Yeah, the goal is to help remove the stigma, is because, like you said, if I am listening to one person or one set of people that have a certain belief, and that is what I'm taking as truth, as opposed to, well, I can equally come over here with people that have complete different information, scientifically backed, by the way, right? And say, hey, have you thought about this, to help open up and explore? And so that's one of the things that I know I enjoy doing here, and why we work with you, is because we want to open up perception and say, let's question everything so we can look through a different lens of what life looks like.
Sure. A lot of times I'll tell people, like, when you come in, like if you had a broken leg, you got to put a cast on your leg, you can see it, and you know when it's coming off, and you know every day you're progressing. You got opiate addiction, it's invisible. When you take, this, you don't know. If you take maintenance, you don't know ever when it's going to end. But, like I said, unfortunately, that can be like a cast that you have to take for a certain period of time to get you down the road long enough where your circumstances are different, your stressors aren't there anymore, you kind of understand yourself, you understand accountability and responsibility, you're just thinking differently. Then it's time to kind of titrate off that. That's why it's important when you're in maintenance to be getting therapy, see your doctor, stay in that mix and keep your head in the game, and be intelligent about it. Because when you get around people who project their feelings onto you, that's all about them. When they tell you, hey, that's one drug for another.
Right.
People hear that. I hear that all the time. I even have young guys, men and women, battle that, mostly men, because they look up to somebody that doesn't believe in what they're doing. They kind of almost feel ashamed, which I tell them, fill yourself up with shame, then you'll be alive in 2 or 3 years when you come off this stuff, and I promise you probably won't even know those people.
Yeah, well, that's one of the driving core issues that we see and really deal with, is the guilt and the shame. That is the danger. Well, so from what it sounds like, is it's really individualized for the individual of what they're on, what their treatment plan is. But what I heard first and foremost is their safety, making sure that they're in a safe space to come up with a plan that gives them the shot at changing their life.
Yeah, when they get here, like I assess that with them. I take just a few minutes to talk to them about how I want you to communicate with me and the staff. That's the most important. I don't want you isolating. I don't want you building a resentment, because that's what it leads to. You don't communicate. Yeah. Especially if you're kind of scared, you've had bad experiences, or you've just never done it before.
So if there's someone who is thinking about stopping what they've been doing, drugs, alcohol, whatever it is, but they're not really sure, what would be your professional words of wisdom?
I would say at least you could pick up the phone and call somebody and ask and talk to them. That's just your first step. Just call somebody, call the center, call here, talk to somebody and see if it's a fit. Tell them what you're going through. Be truthful, and just trust it. Because ask yourself a question: has anything you've done worked?
It's a powerful question.
As it hasn't. So.
Cool. Well, thank you. Appreciate you taking time and answering some questions and just hanging out.
Thank you for listening. We're so glad you're here, and we hope that you found this episode helpful. We're going to ask that you leave us a review. if you found this helpful, because what it does is it helps other people find this valuable resource to hear these inspirational stories in order to grow. Now, once you leave the review, I'm going to ask that you take a screenshot and then send me the email. And you can send it to Mark, M-A-R-K, at PacificShoresRecovery.com. And what I'm going to do is every single month, we're going to pick one winner, and we are going to offer a free one-on-one breakthrough session, either virtually in here, or if you're in person, would love to meet you with me. That will help see where you're stuck, where you want to go, and to help create this bridge to help get you there. So thank you again for listening. Want to make sure that this continues to be highly valuable time. Please leave us a review, and love to see you in our raffle for the 101 breakthrough session.